Hello, I am Dr. Tauseef Nissar. I am an associate consultant cardiology in Paras HMRI Hospital. So today we are here with the latest update in hypertension. As we all know that almost 63% of the total deaths in India are due to non-communicable diseases, out of which almost 27% are because of cardiovascular disease, with effects around 45% in people in 40 to 69 age group. So raised blood pressure is one amongst the important risk factors of cardiovascular disease. Moreover, it remains poorly controlled due to low awareness, but hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up to 30 years to 38% in men and 32% in women, with from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, are unaware of the condition. Additionally, over 62% of the men and more than 53% of women living in hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension. This is the worldwide journal Lancet 221. International Society of Hypertension has released the ICH 220 Global Hypertension Practice Guideline. The inclusion of optimal and essential treatment paradigm attempts to address the issue that in a resource poor setting. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource setting. In AHA and ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low cardiovascular risk. Among low risk adults with less than 10% of the people with 10-year-old with stage 1 hypertension, blood pressure of 130 to 139 oblique 80 to 89 mmHg, management starts with non-pharmacological methods. If blood pressure remains uncontrolled at 3 to 6 months, consider starting a pharmacological therapy. Then in acute respiratory distress like ARDS is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. At a recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce the lung inflammation and improve respiratory functions in people with COVID-19 ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 mmHg range substantially reduce cardiovascular adverse events in STEP randomized trial, affirming the sprint findings for an older Chinese population. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not be dependent on office BP management, but also on out-of-office measurement, such as home blood pressure monitoring, 24-hour and nighttime BP measurement were associated with greater risk of mortality and a composite of cardiovascular outcome. Thus, they may be considered a most relevant measurement for estimating cardiovascular risk. For every 20 to 10 mmHg increment of blood pressure measurement at night, the risk of mortality increased by 23% and risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. In 2018, European guidelines equally recommended 5 classes of antihypertensive drugs, considering the high non-adherence treatment to the importance of combination treatment is particularly highlighted to improve adherence to the therapy and BP control. Therefore, in 2018, European guidelines recommended, especially in the context of lower BP targets, to start antihypertensive therapy with initial dual fixed combination of ACE or ARB plus CCB or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogenic name as NDMA, which can be found in candacetrone, erbicetrone, losartan, elmicetan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If around 1 lakh patients would have received NDMA contaminant valsartan from a Zhejiang Hu manufacturing site, it would result in 22% additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to additional cancer risk out of 8 additional cancer cases in around 1 lakh patients if they had been taking the highest daily dose of around over 4 years. Valsartan recall accompanied by significant increase in rate of emergency department visits of plus 6%. The HYGEIA study represents the largest study that tested nighttime antihypertensive treatment in this trial. Chronography was associated with significant reduction in endpoints, including death. The HYGEIA chronography trial tested whether nighttime therapy, in comparison to usual awakening hypertension therapy, exerts a favorable cardiovascular risk reduction. The largest study included a total of around 19,000 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect the data on how BP differed during sleep. The respiratory rate reduction for cardiovascular events was significantly improved for the nighttime treatment when compared with the awakening treatment. Thank you.